Hi, my name is Ken Cutbush. I'm an orthopaedic surgeon working in Brisbane. I'm going to talk to you today about the potential risks and potential complications of a posterior bone block for instability. So what we're talking about is an operation like this. This is a 3D CT scan of a scapula of a shoulder blade. And you can see this bone block that's been put at the back of the shoulder with two screws there. The little holes there are anchor placements to repair the labrum. The way I do it, I use a distal tibial allograft, a donor bone, and we cut a little bone block from that distal tibia. The distal tibia is actually a good match for what we're doing here. That's why we use it. And I use the 3D cutting guides. So this company is very clever. They actually CT scan that donor tibia and they create 3D cutting guides that will give me the exact match for where we want to put it here, because that's been CT'd as well. And the two are registered. So a pretty cool way to do the operation. Now, when I'm talking to patients about a posterior bone block, first thing is, it's not a very common operation I do. Most instability is anterior instability, anterior dislocations. About 90% of all instability is anterior and 10% posterior. So posterior is rarer and is more difficult to deal with. The risk of infection, I do these in arthroscopic operations, so it's 1 in several hundred for that. There's a risk of nerve injury. The axillary nerve comes around underneath the shoulder here and it goes to the deltoid, that meaty muscle on the side of the arm, and that's always a risk. It's rare, but that's something to think of. Frozen shoulder, anytime we're operating around the shoulder, there's a risk of frozen shoulder. Frozen shoulder will go away and resolve, however, it can be a bit miserable until it does. And there's an anesthetic. Anytime we're doing an operation like this, there's a significant anesthetic, and that needs to be thought of and brought into account. Now let's put some science behind this. There are two papers we're going to look at. One is Cilio in the Knee Surgery Sports Traumatology Arthroscopy Journal in 2016, and they reviewed 13 significant papers on this topic. And then Mojica in Journal of Shoulder and Elbow Surgery in 2021, they looked at 11 reviews with 225 patients all up and looked at the complication rates seen in that body of work. And what they concluded is complication rate was relatively high, almost 14%. What are those complications? Well, there was about a 1% complication rate with graft complications, difficulty with it breaking or fracturing or not uniting. Recurrent instability after the posterior bone block. As I mentioned, posterior instability is more difficult to deal with and more difficult to solve than anterior instability. So about 10% of patients had continued problems with dislocations and instability even after having the surgery. Hardware complications, about 11% of patients had problems with the hardware, so that's with the screws being too long or migrating or issues there. Residual pain, about 11% of patients had residual pain in their shoulders and shoulder discomfort. Their shoulder problem wasn't completely fixed by this. That may be related. Maybe they had some arthritis, maybe the bone block wasn't entirely correctly positioned. Those sort of issues. Wound complications, that's probably more for open operations. This is done as an open operation as well. And they put that at about 0.4%. And they had a nerve complication rate of 0.4%. So that's 1 in 200 basically. That to me seems fairly high, but it's certainly something to think of and consider. If you'd like to go and look at these papers, if you scan that QR code, it will take you directly to that scientific paper and you can read it yourself. Thank you for listening.